Hello, my name is Andy D'Antonio, and I am the Director of Communications at the National Health Law Program. Today, I'm interviewing Miriam Harmatz, Founder and Director of Advocacy at the Florida Health Justice Project, as part of NHELP's Working Better Together series. This series gives our health law partners a platform to highlight successes, challenges, and innovative approaches to furthering health access and health equity in the states where they work. Miriam, so wonderful to speak with you today. How has the health partnership with the National Health Law Program contributed to health justice in Florida?
It's been nothing short of transformational because being able to enforce the healthcare rights of vulnerable Floridians is an absolutely essential advocacy tool. And the Health Law Partnership has made it possible for our legal director and the National Health Law Program to bring cases that secure those healthcare rights, from ensuring due process to obtaining needed medical care. And I hope you'll check out our website on the Health Law Partnership.
Does this health law partnership intersect with sharing the lived experiences of Florida Medicaid recipients?
They're inexorably intertwined. We cannot do health justice advocacy without clients who are willing to partner with us, whether as named plaintiffs in a class action or as part of our lived experience project, where we've elevated the stories of pregnant women, children, seniors, persons with disabilities who are facing barriers to coverage in Florida. One good example is illustrated by Japheth's experience. He's a former foster youth who had been unable to get Medicaid, which violated federal law. The Health Law Partnership, which only files a lawsuit as a last resort, wrote a very detailed demand letter, carefully explaining the law and the facts, and the state fixed the problem without the need for litigation.
Thanks, Miriam. That work sounds amazing. So, what are your all's plans for this health law partnership as we move into 2023?
Like Medicaid advocates all over the country, we're preparing for the end of the public health emergency's ongoing coverage requirement. And the risk of coverage loss, which is huge, is going to be much, much worse in states like Florida that have not expanded Medicaid. As part of our health law partnership, we plan to assist clients who are losing Medicaid, identify and address whatever systemic issues might occur, and continue creating and updating resources and training tools like the Public Health Emergency website. That, among other things, helps advocates in the press understand who is most likely to lose Medicaid in Florida and why, and a companion page on our lived experience website for sharing stories of people who had Medicaid during the pandemic and who, like Iris, will end up in the coverage gap. And this training video, which unpacks why so many parents and caregivers in Florida will lose Medicaid and walks through how to help families understand if notices terminating coverage are correct and how to explain to clients who are now over income for Medicaid, but below the poverty level, that they are in a coverage gap because Florida has not expanded Medicaid. And finally, we are really looking forward to working with our health law partners in the other non-expansion states so we can effectively share the lived experience of the hundreds of thousands of people who had Medicaid during the pandemic, but who, like Iris, will lose coverage. There's going to be a tsunami of coverage loss in non-expansion states, and this will be a huge story in the ongoing struggle for health equity in our 12 states. So we want to follow Winston Churchill's advice not to let a good crisis go to waste. So Andy and NHELP, thank you so much for all your support in the Health Law Partnership with the Florida Health Justice Project.
Well, thank you again for joining us, Miriam. It was a delight to speak with you and to talk about all the amazing work that is happening with the Florida Health Justice Project. We so very much value your partnership and are glad to be able to lift it up as part of our Working Better Together blog series.